What exactly is EHR interoperability for those who don't know? And why should it be a strategic priority for hospital executives?
Absolutely. So yeah, as I was saying with, what we do, EHR interoperability, that's the exchange of, patient healthcare data between different systems, sometimes between multiple EHRs, but they're between different healthcare medical diagnostic systems. And what this does is it, increases again the availability of patient data to the clinician, the provider. And the thing is there is so many different pieces of information in healthcare systems and hospitals, all the way down. We could even talk about one hospital. There's so many different pieces of information spread across the different systems. There, all that data is not sitting just primarily in your EHR, lab, radiology, pharmacy data, diagnosis data, even billing information. We can go on and on. So what does that mean? That means that as a clinician, when I'm sitting down and interacting with my patient, I can't run to all of those different systems to try to get that information because that's just too much and not efficient. And so what we do is make sure that that data can be shared amongst many systems, primarily the EHR, because that's where most of your treating physicians work out of. But we want to make sure all that relevant data gets shared into the EHR and into other systems. So then no matter where that clinician is within the healthcare workflow or the patient workflow, they have that information at their fingertips. And to for your second question as to why it should be a strategic priority for hospitals. It should be a priority because again, it enhances quality, safety, efficiency, and the overall patient experience. So um, you know, and there's many other, benefits as well. Like, we can get into, revenue, of course, as well. You have to, whether you're not for profit or, in the private sector, there has to be operational revenue to keep things flowing that way. And that all is based on the full, journey of the patient, being admitted all the way to discharge.